is Wendy Jones, and you're listening to The Patriot, FM 101.5, AM 1400. Welcome back to Next Steps for Seniors. We're here today with Dr. Kallabat talking about stem cells, and it is pretty fascinating, I've got to tell you. One of the questions I have is the difference between stem cells and exosomes?
Correct.
Okay. Talk to us about what that is.
Well, exosomes basically are a newer method of delivering stem cells and doing stem cell therapy. Exosomes are stem cells, but they're extracted from stem cells. So basically, if you look at a stem cell is a larger piece, where exosomes are about 1/1000th the size of a stem cell.
Okay.
So the way that exosomes work is they're a little bit more unique in that they don't contain DNA. They are less likely to be rejected in the body, and they basically act as communicators from cell to cell. To give a little bit of a better understanding of how exosomes work, you can imagine if you're in a big city, say New York or Chicago, and you're standing on top of a building, and you look at all of the buildings below you, and each one of those buildings is a cell. Mm-hmm. And then the people that you see below you are basically the exosomes walking in and out of different buildings and performing their functions. So when you look at it from a broad perspective, you're looking at the exosomes as the people walking in and out of a building, communicating and handling their business and walking out and going on. And that's really what exosomes do, is they're basically more or less involved in cell-to-cell communication to make the cells that you already have work and to also regenerate new cells or tissues based on what part of the body you're using them for.
Okay. And this is what you're using when you're going in and doing your research.
Correct.
And with your patients. Okay.
Correct.
And the other question I had, we talked a little bit about the umbilical cord.
Yes.
And this is my question. I don't know if our listeners are thinking the same thing. Nowadays, when you do that and you're saving the umbilical cord, are you able to use that with multiple times, or is it just like a one-time use kind of a thing? Like, explain to us a little bit how that works.
It's an interesting question. I think it really all depends on how much volume was taken when the stem cells were extracted from the umbilical cord.
Okay.
So, and then it also depends on what use you're using your stem cells for and what volume you need. For instance, when you do a knee injection, you only need 1 to 2 milliliters of volume. So you don't need a high volume of stem cell. And most people will, when they do extract stem cells when the babies are born, take much more than that. So it really just depends on how much you're using and how frequently you're going to need it.
Okay, and you're using it not just in knees, correct? Like, what are some other components of the body that you're able to?
Stem cells can be used in almost any part of the body. What we do at New Life Medical is we use it mostly for joints, which is the most important thing. Knees obviously are a big part of it because that's really what our passion has been, but we've noticed such an improvement with stem cells that we've looked at other joints and used it for shoulders. It's really helpful for even tendinitis. So people who come in with tennis elbow, golfer's elbow, you can inject stem cells in those areas. Shoulder discomforts are a very big area that we use stem cells for. There's a lot of different benefits in any joint that you can get a needle in reality.
So can you educate our listeners a little bit off topic just for a second on like how arthritis, like arthritis is on the rise, and I feel like everybody's got arthritis. Is it just use over time? Like, what exactly is happening in the body to cause that?
Well, osteoarthritis is an interesting topic only because we usually label it as a wear and tear arthritis, but it really is a little bit more than just wear and tear. Most people who have osteoarthritis, it's usually a wear and tear, but there's also more of a cellular component that happens with it where we don't understand all of that either. So there's more and more research being done as to what's creating osteoarthritis, because in general it is a wear and tear arthritis where the older we get, the more we've used our joints, so you're going to notice more of a deterioration. But it doesn't explain why some people who use their joints a lot don't develop osteoarthritis, and why some who don't use their joints at all do develop it. So there's a little bit more, and that's why it's very important to look at doing therapies with stem cells, because we're attacking it more at the cellular level, and we're helping to regenerate tissue as opposed to just general physical therapy. But when you use things in conjunction where stem cells are used, therapy is used, bracing is used. There's a whole regimen that we use at New Life that really helps people gain the most benefit for it. But that's what really osteoarthritis is. It's multifactorial, I would say. It's probably the best way to answer that question.
Mm-hmm. And you've had patients that have actually had this procedure done, and they're walking again, maybe without a cane.
Absolutely. I had a lady a month ago who was at one of our seminars, and she was using a cane and inquired about the treatment, and I saw her in the hallway as I was going to New Life, and I said, "Oh, how are you feeling?" She said, "Well, I'm not walking with my cane anymore." So it was a very nice thing to hear. So definitely a nice success story.
That's excellent.
Yes.
It's got to be life-changing.
Oh, absolutely.
I mean, they're able to kneel. I had a lady, this was last week, she said, I fell on the ground and I could not get up. And I was like, well, and I'm teaching her, I'm in my head, I was like, you roll over, and they say to use your arms and get onto your knees. And
Yes.
then, right, that's the right way to get up.
Yes.
And she's like, oh, no, dear, I can't put any weight on my knees. And I thought, oh gosh, like then how do you get off the floor if you can't use your knees?
Well, that's why a lot of people end up falling, and the old commercial, I've fallen and I can't get up. It's the reality. I think we joke about the commercial and that, but in reality it's very true, and elderly patients will really fall on the floor and they don't really have a way to get up because they can't roll on their knees, and they end up finding out once they can get on their knees, if that's even the case, their knees don't have the strength or the power to get up, and then there are issues with pain.
Now let me ask you this, if somebody had surgery, okay, on their knee or their shoulder or their or elbow, whatever, could you still do this procedure?
You cannot do it if it's a total knee replacement or a total shoulder, especially total knee, because you really don't have a joint space. Now it's an artificial joint. A partial knee, you still can use this therapy, but a total knee, you cannot, because the knee is a joint that's a hinge joint, basically. So if you've taken the actual cartilage out and the knee joint space, there's really now just an artificial joint. So it really doesn't work well for those patients.
But partials you could?
Partials you can, correct.
Okay.
If you've had arthroscopic surgery for repairs of, say, a meniscus tear or an ACL tear, you still can do this. So anything that didn't replace your joint, you're able to, because a replaced joint is no longer your joint. So
Right.
stem cells will have no benefit, or none of the therapies that we offer will have a benefit, because you don't have your own joint anymore.
Exactly. This is a good time to share your information, because I'd like to know, have patients call you to understand how they can get a hold of your office. What's your phone number? And
Phone number at the office is 248-952-9190. And you can call anytime. We're there Monday through Friday, 9 o'clock till 5 p.m. And we're there to service whatever your needs are.
now, do you need a script in order to come in and see you for stem cell from a physician, or
No.
they just can call
They
and get
can
a
call.
consultation?
Absolutely.
Why wouldn't we call? I love it. I think it's great. Talk to us a little bit about some of the other services that New Life Medical offers.
Well, we do offer a lot of different services in terms of advanced arthritic knee relief, joint relief. Part of the services we offer, as we just discussed, is stem cells. One of the other services that we offer on the regenerative line is PRP, which is platelet-rich plasma. That's also a very interesting type of therapy where you draw blood, your own blood,
Okay.
from your body, and basically spin it in a centrifuge. And then what's left at the top of this test tube is basically the platelet-rich plasma, which we withdraw in a tube or a syringe, basically, and re-inject that back into a joint. And that purpose of that is to create more of a pro-inflammatory response, and that also generates a lot of different chemical reactions in your knee to provide knee regenerative therapy. And people have
And
noticed.
is that quicker than, like, as far as the healing process than the
They're
stem cells?
pretty much the same
Okay.
in terms of how quick they act. Most people who get these therapies, depending upon how bad their knee arthritis is, or even their shoulder arthritis, patients will ask that all the time, is how fast am I going to get better? And a lot of the how fast it is based upon how bad your knees are
Right.
and your age and other comorbidities, and comorbidities meaning your health. So do you have diabetes? Do you have high blood pressure? Do you have other issues that could be, in the way of making you feel better? But most patients, usually will notice a difference within a week or so.
Are there any patients that you're not able to perform stem cell on?
The most common one would be somebody who has severe cardiac issues and are on blood thinners. So we want to be very careful because we're putting a needle in a joint. So if they're on warfarin or Coumadin, we want to be careful with that. If they're on other blood thinners like Eliquis, these are things that we want to be cautious with because you're putting a needle in someone's joint. So you want to be careful that you're not going to cause any bleeding or unnecessary bleeding.
Right, no, absolutely, and that makes perfect sense. But that's good to know because
Sure.
I gotta believe a lot of people are able to have this procedure done. And I'm gonna have you in the next segment walk through the process, like from when they come in, because of course people want relief right away. And
Sure.
maybe they will have it, but I wanna know how many times they have to come, how that process works for both of these, if
Sure.
we can talk about stem cell and the PRP.
Absolutely.
Okay, we'll be back in a few minutes. And we do have a Facebook page, Next Steps number 4, Seniors, and I'm sure you do too. Go ahead.
New Life Medical is
New Life Medical.
correct.
And we'll be back in just a moment.
I looked
Stay
up
tuned.
yesterday.